Have you ever wondered how you quickly lower your blood pressure at home? In this episode, you will find the answer. This is going to be mind-blowing, I promise.
It will be John. In my decades of practice, I have seen that for millions of seniors, high blood pressure is not just a medical diagnosis, but a daily source of severe anxiety. You take your medications, watch your salt, but those terrifying spikes still happen, and the fear of a stroke constantly lingers, leaving you completely helpless when numbers jump. The worst thing is that most assume the only option is to sit perfectly still and wait for a pill to kick in. But today we will prove that is simply not true.
Welcome back to the Senior Health Podcast, where East meets West to help you age strong, move freely, and stay independent. In this episode, Japan's oldest doctor is going to show you a completely different approach to managing your cardiovascular health. In traditional Japanese medicine, we do not view high blood pressure as just a mechanical issue with your heart. We view it as a buildup of internal heat and tension. And just like a pressure cooker, your body has built-in relief valves. So today, we are going to teach you how to manually open those valves. We are going to guide you through 3 specific acupressure points that signal your nervous system to instantly dilate your blood vessels and drop your blood pressure. Doctor, I know you have used these traditional Japanese massage techniques in your clinic for decades. Why do these specific pressure points work so incredibly well for seniors who struggle with hypertension?
Because they bypass the conscious mind and speak directly to the autonomic nervous system. In Western medicine, we often treat the body like a machine made of isolated parts. If the blood pressure is high, we give a pill to slow the heart. But in Japanese shiatsu and acupressure, we understand that the body is an interconnected network of meridians or energy pathways. When tension blocks those pathways, pressure simply builds up in the chest and the head.
So these pressure points act as physical switches to release that exact tension?
Precisely. When you apply firm circular pressure to these specific neurological hubs, you send a massive calming signal directly down the vagus nerve. This tells the brain that the emergency is over. The brain immediately responds by relaxing the smooth muscles inside your blood vessel walls. The vessels widen, the trapped blood flows freely, and the pressure drops safely and naturally.
That is an incredibly empowering concept. We actually have the physical tools right at our fingertips to protect our own hearts. But before we get into the exact locations of these 3 points, I want to ask our audience to check in with us. Please pause the video right now and go to the comments. Type the topic you have questions about and what you want us to cover in a future episode. We take every suggestion in mind.
Yes, please let us know in the comments, and I will see what we can do for you.
Doctor, before we touch the very first pressure point, you mentioned in your clinical notes that there is a mandatory golden rule people must follow. You said that if they skip this one preparation step, the massage simply will not work. What is that rule?
The golden rule is that you must bring your body into a receptive state before you begin. You cannot just aggressively jab your fingers into your head while you are in a state of active panic. If you apply acupressure while your breathing is shallow and rapid, your nervous system will resist the physical touch. Your muscles will act like a brick wall.
So we have to tell the body that it is safe to receive the treatment first. How do we do that?
It is very simple. Before you bring your hands to your head, I want you to sit back in a comfortable chair. Uncross your legs and place both feet flat on the floor. Now, simply close your eyes. You are going to regulate your breathing for just 15 to 30 seconds. Take a slow, deep breath in through your nose. Let your belly expand, and then slowly sigh the air out through your mouth.
Just doing that one time already lowers my heart rate. It forces the tension out of the shoulders.
Exactly. Do that 3 or 4 times. Close your eyes. Breathe deeply and consciously let your shoulders drop away from your ears. Once you feel that initial layer of panic melt away, your nervous system is now an open door. Your blood vessels are primed and ready to respond to the acupressure. Now, we can begin.
I love that preparation. It sets the perfect tone for healing. Let us move to the very first pressure point. Where is it located, and how do we find it?
The first pressure point is a highly revered spot in Japanese medicine. It is called the 100 convergences. It gets this name because it is the exact meeting point of all the major energy pathways in the head. It is located on the absolute highest point of the crown of your head, right on the center line.
How does someone find the exact center point without looking in a mirror?
There is a very easy physical trick for this. I want you to take the index fingers of both hands, place one finger at the very top tip of your left ear and the other finger at the very top tip of your right ear. Now slowly trace both fingers straight up the sides of your head until they perfectly meet at the very top center of your skull.
Okay, my fingers have met at the top.
Now press down gently with your middle finger right where they met. If you move your finger around just a tiny bit, you should feel a very slight, soft depression in the skull. It feels almost like a tiny little pit or a divot. That is the 100 convergences pressure point.
I feel it. It is very distinct once you know what you are looking for. What do we do now that we have found it?
You are going to use your middle finger to press down gently into that pit. Do not push so hard that you cause pain. You just want a firm, steady pressure. Keep that downward pressure locked in and begin making slow circular rotations. We want to do 30 to 50 circular rotations clockwise.
Let us do this together with everyone watching at home. Find that pit at the top of your head. Press the middle finger in gently. Now slowly rotate clockwise. Keep the movement small and controlled. You are massaging the tissue directly over that depression.
Keep rotating. Focus on your breathing while you do this. This specific pressure point is incredibly powerful for seniors who have high blood pressure that is accompanied by head symptoms. If your blood pressure spikes and you instantly get a throbbing headache, or if you feel sudden waves of dizziness and vertigo, this is the point you must use.
I can see why. It feels like it draws all the heat and pressure right out of the top of the skull.
It does exactly that. It vents the excess heat from the nervous system. Once you complete about 30 to 50 rotations in the clockwise direction, you simply reverse it. Keep the pressure applied and do another 30 to 50 slow circular rotations counterclockwise.
That is a fantastic daily habit to build. Whenever you feel that dizziness coming on, just trace up from the ears and massage the crown of the head. All right, doctor. We have cleared the pressure from the top of the head. What is the second pressure point in our routine?
The second point targets the exact mechanical reason why so many seniors develop high blood pressure in the first place. This point is called the wind pool. It is located at the back of the head, right where the skull meets the neck.
I know a lot of people carry immense amounts of stress in the back of their neck. How do we locate the wind pool?
Take both of your hands and reach around to the back of your neck. You will feel two thick vertical bands of muscle running up either side of your spine. I want you to place your thumbs on the outer edge of those thick neck muscles. Now, simply slide your thumbs straight up the back of your neck until you hit the hard, bony base of your skull.
Okay, my thumbs have slid up the outside of the muscles and they are resting right underneath the ridge of the skull.
Perfect. Right there at the base of the skull, on the outer edge of those neck muscles, you will feel a deep, hollow depression on both the left and the right side. Those two hollow pockets are the wind pool pressure points. You are going to use both thumbs for this one.
I have my thumbs locked right into those hollows. What is the technique here?
Press inward and slightly upward with your thumbs. You want to feel a dull, satisfying ache. This is an area of massive tension for almost everyone. Keep that firm pressure applied and begin doing slow, circular rotations. For this specific point, we are going to do this for 2 to 3 full minutes in a clockwise direction, and then 2 to 3 minutes counterclockwise.
That is a significant amount of time. That is the 3-minute massage we mentioned in the title of this episode. Why do we need to spend so much time on the base of the skull?
Because this area is a massive bottleneck for your cardiovascular system. The main arteries that deliver oxygenated blood to your brain have to pass directly through the muscles of your neck. When you are stressed, or if you have poor posture from looking down at a phone or a book, those neck muscles become as hard as concrete.
So those tight muscles are literally clamping down on the blood vessels.
Yes, they physically restrict the blood flow to the brain. When your brain senses that it is not getting enough oxygen, it panics. It sends an emergency signal to your heart, ordering the heart to pump much harder and much faster to force blood through that tight bottleneck. That emergency response immediately spikes your blood pressure.
That is an incredible visualization. So high blood pressure is often just the heart trying to overcome a stiff, tight neck.
Exactly. By spending 3 minutes massaging the wind pool points, you are manually melting away that muscular tension. You release the clamp on those blood vessels. Blood flows freely to the brain again. The emergency signal shuts off, and your heart rate slows down to a calm, resting state. Besides lowering your blood pressure, this point will completely eliminate tension headaches and heavy, aching shoulders.
I am doing the circular motions right now, and I can physically feel the tension radiating down into my upper back and releasing. It feels highly therapeutic. We have done the top of the head and we have done the base of the skull. Doctor, what is the third and final pressure point for this routine?
The last pressure point is actually not located on the head or the neck at all, but it is widely considered in traditional medicine to be one of the absolute most powerful pressure points in the entire body for lowering blood pressure. It is located on your arm, and it is called the pull at the bend.
An arm pressure point to lower blood pressure. That sounds completely counterintuitive. How does that work?
It works through the body's systemic meridian lines. The large intestine meridian runs directly through the arm, and in traditional Japanese and Chinese medicine, this specific pathway is famous for clearing excess heat and high pressure from the blood. It acts as a master cooling switch for the entire cardiovascular system.
That is fascinating. How do we find this master switch?
I want you to hold your left arm out in front of you. Now, bend your elbow to exactly 90 degrees. When you bend your elbow, look at the inside of the joint. You will see a very clear horizontal skin crease forming right where the joint bends.
Yes, I see the elbow crease perfectly.
Now, follow that crease all the way to the absolute outer edge of your elbow. Right at the very end of that crease line, on the outside of the arm, take your right thumb and press inward. You will feel a soft depression sitting right between the muscle and the bone. That is the pull at the bend pressure point.
I found it. It is actually quite a sensitive spot when you press into it.
It is very sensitive, which means it is highly active. Are going to use your thumb to press in gently but firmly. Just like the wind pool, you want to maintain that pressure and perform slow, circular rotations for 2 to 3 minutes clockwise, followed by 2 to 3 minutes counterclockwise.
And doing this on the arm sends a cooling signal to the heart.
Yes, it forcefully dilates the blood vessels throughout the body, spreading the blood volume out and relieving the pressure inside your chest. But there is also a wonderful secondary benefit for seniors who use this specific point.
What is the bonus benefit?
Because of its physical location, stimulating this exact depression is the absolute best treatment for tennis elbow, joint stiffness in the arm, and any numbness or tingling you might feel radiating down into your hands and fingers. You are dropping your blood pressure and healing your elbow joint at the exact same time.
That is the beauty of holistic health. You cannot heal one part of the body without helping another.
Exactly, John.
Doctor, These 3 points are incredible. The 100 convergences on the top of the head for dizziness, the wind pool at the base of the skull to unblock the blood vessels, and the pull at the bend on the elbow to cool the systemic pressure. Please everyone, if you are still here, let us know in the comments you finished this episode, and leave a like before you leave. And make sure to watch this next episode.
Oh, this is a good one. People should see
Should
this.
definitely watch. See you there.